I'm Jane Wrede and I'm a certified nurse midwife. So a midwife actually can come in several different forms. There is a nurse midwife, and then there's a professional midwife, and there's lay midwives. And I think there's a lot of confusion around what exactly midwifery is because there's several different kinds of midwives. So I am a nurse midwife, and I'm an advanced practice nurse, so I was a nurse first, then went on to graduate school to become a nurse midwife. And as a nurse midwife, we get to practice pretty independently in the state of Minnesota. So nurse midwives can write prescriptions, they can bill insurances, and they can really practice quite independently. So the American Midwifery Certification Board, it's called AMCB, is the certifying body for all nurse midwives across the country. And so I have been AMCB, I guess, certified since 2003. Nurse midwives take care of women from 13 typically to about 65 years of age. And a lot of nurse midwives tend to kind of specialize in a certain age group or in a certain area. I think all of us know that midwives, most midwives, like to deliver babies and work with women that are pregnant. But we really also, I think, like to optimize women's health even when they're not pregnant. So I think we deal with a lot of women that are just here to see us for well women care, maybe thinking about getting pregnant, those types of things. And birth control is another, I think, very often piece of our practice, just because women after they have babies want to discuss just family planning and their options. I began nursing about 25 years ago in a rural hospital, and I did that after graduating from Mankato State. We did a variety in rural hospitals of different nursing, so ER, med-surg, OB, and soon discovered that obstetrics was definitely the place that I wanted to focus my attention. And I then went on to the University of Minnesota to get my nurse midwifery degree. And then after getting that degree, I went on to SDSU to get my PhD. And that PhD, really, I'm a bit interested in research, but I'm mostly interested in teaching. And so that PhD really helps me teach as well as do a little bit of research on the side. I really like to see women meet their reproductive life goals, and that's a fancy word, reproductive life goals. But basically, I think women from little on have some desires about maybe what size family they want. We play Barbie dolls as little girls, and we play with dolls in general, and I think those maternal instincts start a lot sooner than we probably realize. And so I love to help women meet the goals that they have in their reproductive lives. And so I think a lot of them enter maybe 20 to 25 years old, a time when they're starting to think about how many children do I want to have and how far apart do I want each child to be. And so whether that means helping them get pregnant or helping them not get pregnant, I want them to get pregnant when they're ready to get pregnant. So they're healthy and so that they're in a good emotional state and they're empowered to be great moms. So CCM Health, I think over the 25 years that I've been kind of in and out of the system in several different realms, has shown me that they're committed to great health care for the entire community. So I think there's a variety of options that they've worked hard and diligently to offer their clientele, and I am excited to work in a couple different clinics and keep those opportunities open for folks who live in rural areas. So I'm from Clara City, Minnesota, and my husband and I moved up here 25 years ago for his accounting position, and I started here in Montevideo soon after that, and we've raised our 4 children here. 3 of my children are married. I have 3 grandchildren, and then I'm also trying to raise a 16-year-old, and so I kind of feel like I'm in between 2 generations. I'm a grandma and I'm raising a teenager at the same time. We have 2 labs, which have become our family members. On the side, I do breed those labs, and so sometimes I call myself a mid-wolf because I'm also helping those dogs raise their little puppies and that litter of puppies. I'm going to be seeing patients in the Montevideo Clinic, in the Clara City Clinic, and also the Clarkfield Clinic. So it's exciting to think about midwifery in some of those really small rural clinics I think that makes CCM Health pretty unique in making sure that midwives are in those very rural clinics. And I know a colleague, Molly, works over in the Mylan Clinic, and so I think there's midwifery in all of our clinics now, and that's exciting. To schedule an appointment, feel free to contact the front desk at CCM Health. We'd be happy to see you.